Hey y'all, this is Nancy Giron. Today I'll be talking to you all about Neisseria Meningitidis. I have created a PowerPoint with broad points over the bacteria. I hope y'all enjoy. So Neisseria meningitidis. It is a bacteria from the family Neisseria and its genus group Neisseria. It is a capsulated gram-negative diplococci. It is usually an intracellular bacteria that causes disease and can be fatal. It is kidney-shaped with flat adjacent sides, red stain under a microscope. And there is my gram-negative red stain picture. Its antigen is a polysaccharide capsule that splits into 13 different serogroups: A, B, C, D, W135, X, Y, Z, H, K, and L. Strains B, C, and Y are the primary cause of most meningitis cases in the U.S., with the highest percentage of outbreaks usually accounting in children 1 through 5 years old. There is my capsular picture. Neisseria meningitidis houses in the upper respiratory tract of humans. In fact, humans are the only known host to the bacteria. The bacteria can live in the respiratory tract for 1 to 5 days, and the person can be asymptomatic, otherwise known as carriers. There is my upper respiratory system. So the antigen can be present in the respiratory system of the patient, and they can have or not any symptoms. And so if they don't have any symptoms, they're known as carriers because they carry the antigen with no symptoms. Meningitis is the most common meningoccal disease caused by Neisseria. Meningitis is a disease that attacks the lining of the brain, spinal cord, and harbors serious infections to the bloodstream. So, given that the disease attacks the lining of the brain and the spinal cord, usually when diagnosing meningitis, tests are usually performed through a sample of the patient's cerebrospinal fluid, and the antigen is fetched through that. So given that the meningitis fights aggressively, it should always be considered an emergency when suspected. And 10% of infected people die. There is a ratio of 1 to 5 of survivors who face long-term disabilities, including hearing loss, skin scarring, loss of limbs, and nervous system dysfunction. So Neisseria meningitis can be transmitted directly through contact and or airborne droplets. Incubation period is usually 1 through 7 days. Anyone who is considered exposed to an infected individual must receive antibiotics to prevent contraction of disease. And there is my little picture of transmission of human pathogens. So if exposure is suspected, here are things or signs to look for. In children is usually neck, back stiffness, neck rigidity, bulging fontanelle, fever, and vomit. In adults, it's joint pain, stiff neck, fever, vomit, and drowsiness. When diagnosed, an agglutination test is usually performed. It is used to fetch polysaccharide antibodies of meningoccal bacteria, and results are fast as 20 to 30 minutes. Blood culture tests are also used to grow bacteria cultures and identify proper treatment. So there are my pictures of my culture test dish. For prevention, there are two main vaccines in the US being used to prevent against meningococcal disease. The first one is meningococcal ACWY vaccine. The second one is serogroup B meningococcal vaccine. The vaccines are recommended at 11 through 12 years of age and or during an outbreak. However, vaccines are not 100% liable for prevention, so the CDC highly recommends individuals to wash their hands thoroughly, practice good hygiene, cover exposing coughs, and be alert of overall health. So treatment varies depending on how chronic the infected person is. Typically, empirical antibiotics are prescribed. Here are a few listed. The antibiotics are safe for adults and children over 3 months. Very rare but common cases of extensive meningococcal complications are usually treated with therapy. Usually it is definitive due to the patient's impairments caused by the bacteria and other disabilities. So there are my treatments. Okay, and that's all I have for that. I hope y'all enjoyed this information. Thank y'all for watching.